Lifespan of white blood cells. White blood cells are also called leukocytes. They are the cells of the immune system that are involved in protecting the body against both infectious diseases and foreign invaders. Monocytes have a short transit period, being in the blood for 10–20 hours. Then they exit through the capillary membranes into the tissues. In tissues, the size of monocytes increases significantly. They become tissue macrophages, or conventional dendritic cells, and in this form they can live for months until they are destroyed during the phagocytic function. Tissue macrophages form the basis of the tissue macrophage system, which provides ongoing protection against infection. Granulocyte or neutrophils. After their isolation from the bone marrow, normally last for 4–8 hours in the circulating blood, and another 4–5 days in the tissues that need them. During a severe tissue infection, this total lifespan is often shortened to a few hours, as the granulocytes enter the infected area even faster, perform their functions and self-destruct in the process. Eosinophils. The tissue lifespan of eosinophils ranges from 2 to 5 days, depending partly on the tissue studied. Eosinophils have a circulating half-life of approximately 18 hours. They are capable of locomotion and phagocytosis and can enter inflammatory sites, but do so less readily than neutrophils. Cytokines increase eosinophil survival in winter to 14 days or longer. They likely also prolong eosinophil survival in vivo. Basophils. Basophils are the least common type of granulocytes, representing about 0.5% to 1% of circulating white blood cells. However, they are the largest type of granulocytes. They are responsible for inflammatory reactions during immune response, as well as formation of acute and chronic allergic diseases, including anaphylaxis, asthma, atopic dermatitis, and hay fever. The lifespan of basophils is short, recently estimated to be in the range of 1 to 2 days. Lymphocytes constantly enter the circulatory system along with lymph drainage from the lymph nodes and other lymphoid tissue. After a few hours, they exit the blood into the tissues by diapedesis. Then the lymphocytes re-enter the lymph and again return to the blood. So there is a constant circulation of lymphocytes in the body. The lifespan of lymphocyte is weeks or months, depending on the body's need for these cells. Although lymphocytes have maximum lifespan among other white blood cells, including T cells, subdivided into helper T cells, memory T cells, cytotoxic T cells, and B cells subdivided into plasma cells and memory B cells, and natural killer cells. So, in summary, we can say monocyte circulating life is approximately 10 or 20 hours. Granulocytes or neutrophils normally last for 4–8 hours in the circulating blood and another 4–5 days in the tissues. Eosinophils circulating life is approximately 18 hours. Tissue lifespan of eosinophils ranges from 2 to 5 days. Basophils. The lifespan of basophils recently estimated to be in the range of 1 or 2 days. Lymphocytes. The lifespan of lymphocyte is weeks or months, depending on the body's need for these cells.